Hello. We're going to interview Stephanie Naylor about her perception of evidence-based practice in athletic training. Stephanie is joining us from Boston University, Boston University, with 4 years of experience as an ATC. So, Stephanie, we're going to ask you a couple questions, and if you could, just kind of give us your perception. So, first of all, we'll just ask, what is evidence-based practice to you?
So I think evidence-based practice is figuring out what the best treatment, diagnosis, special tests, whatever it is that you need to use to help with a patient, either diagnose or to treat, whether it's rehab, whether it's, like I said, treatment. And it's really trying to figure out what is going to be the best to help that person either get back on the field, in the work environment, whatever it is they need to do. So trying to figure out what with the evidence is going to help you be able to treat your patients the best.
Okay. How do you utilize evidence-based practice in your current athletic training?
So at Boston University, we do a lot of evidence-based practice. We do a lot of talking, a lot of reading. Personally, I think I've definitely read a lot more after coming to Boston University and just kind of see what the literature says about different treatment plans. I know personally I've definitely switched up how spine boarding and how I use, I don't use log roll anymore. I do like the 6-person lift because that's only something that I've learned from there, which it's provided less movement. So I think it's just trying to stay up to date and seeing what the best stuff is out there and trying to keep moving forward.
Okay, all right. Do you feel that you're prepared to practice evidence-based medicine?
I've gotten better. I definitely didn't learn a lot in my undergrad. I knew what it was, but I didn't really read enough, I think, at that point, and actually practice what the evidence said and really take that to heart. I think it's getting better. I don't think I'm where I need to be, per se, but I think I'm definitely moving more in that direction.
Okay, good. How much experience do you have with evidence-based practice?
Like I said, it's definitely gotten a lot better once I've actually been practicing and seeing, reading a lot more. We definitely will, whenever we have any situation happen at Boston University, whether it's emergency management or something of that nature, we definitely kind of look and see what happened and really try to assess and critically assess kind of what we did, what happened, and then look into the evidence and see what's going on. So right now I'm actually on a task force looking at iron deficiency in athletes because we've had a lot of coaches want all of our athletes to be tested for iron, and it's really delving in the evidence and seeing what that says and just reading a lot more. So, yeah.
Can you give me an example of a particular situation that you may have determined the comparison between evidence-based practices and what you chose to treat that patient with?
I think the way that I've treated a lot of low back pain has definitely changed. I've been reading a lot more on, obviously, not just doing soft tissue is not the best treatment, obviously, for people that are having chronic low back issues. It's really doing more of a combination between the strengthening exercises with core and glutes and utilizing soft tissue is what has definitely helped outcomes for patients better. So treating a lot of rowers with back pain, that's definitely something where I've definitely really switched up my practice and how I'm actually treating that type of an injury.
All right. Well, thank you for your time. So that was Stephanie Naylor's perspective on evidence-based practice.